Good evening, everyone. My name is Lamise, and I'm so excited to be here today on behalf of Team Change of Mind. First, I want to present to you Sean, Lei, and Sushmi. At Change of Mind, all our team members have one really big thing in common. All of our lives have been greatly affected by anxiety. So either we suffered from it as individuals, or we witnessed our family and friends go through it. And we couldn't figure out what it was about existing treatment options that was failing people like us. But we decided to put our brains together and figure it out. We created Change of Mind, a HIPAA-compliant toolkit for individuals suffering from anxiety to embrace, engage, and manage their stressful moments in life. Right off the bat, we found one pretty big problem. It's a shocking, horrific, and terrible statistic. And here it is. 80% of patients drop out of therapy within 1 to 10 sessions. 80%. Now that's too big of a number to exist on our watch. So we decided to dig deep and ask, why does this happen? We conducted 100 interviews with clinicians, patients, parents, and significant others. We spent at least 40 minutes in every one of these interviews. We went and grabbed coffee with patients. We went and sat in on group therapy sessions at the U of M clinic. And we found 4 major problems. To start, patients have to tediously log data about their anxiety attacks. This includes severity, date, time. Now, for a lot of our patients that we've spoken to, this just isn't the proper solution. They need something quick and easy. Second, in addition to this tedious anxiety logging, clinicians also ask patients to complete homework in between sessions. Now, this homework's paper-based, so it's not private because anyone can see it, and it's not interactive, so patients lose motivation to continue doing it. Third, we know a lot of patients have friends and family, but a lot of patients lack others who actually experience the same things they've had in their social support system. And fourth, data insights. Because if patients don't have a good way to check their progress, they lose motivation to continue in their treatment. Now, these are some pretty big problems. We knew there had to be other people out there trying to address them. And there are. We assessed them using the 4 measurements seen on the left-hand side of the screen. So, convenience of use, quality of exercises, social support available, and ability to check progress. We started with Lantern, an online application using a virtual coach to help guide patients through their anxiety. Now, the thing with Lantern is you enter in data every single day about your anxiety, but you can't look back to it. You literally can't reference your own data. And then there's Empower Interactive. This one's similar to Lantern, but it's very text heavy. It misses the mark with the word interactive in its own title. There's also Self-Echo. Now, Self-Echo is great for clinicians, but that's the only population it serves. It essentially serves as a toolkit for data collection from patients to the clinician, not really addressing any of the patient's needs. And last, there's us. So why are we different than all these other competitors? What makes us so special? Well, to talk about that, we're going to introduce you to Nancy. Nancy's a 24-year-old grad student we spoke to who's been struggling with her anxiety ever since she got into a car accident 2 years ago. Now, when I say struggling, I mean really struggling. Nancy's been having a hard time focusing in her classes, and she experiences physical symptoms every time she gets into a car. So, because Nancy's a busy grad student, she doesn't have time to log all these symptoms in a logbook. Instead of doing this, we've created a feature called Mental Selfie, a quick, private, and interactive way for Nancy to capture her anxiety. So when she's in a rush and she's feeling anxious, she can take a photo or video talking through her attack to remind her the next time she goes to see her clinician. Or, as seen on the right-hand side of the screen, she can simply type in a few lines about what happened and will automatically capture her location, the date, and time. Also, we didn't want to bore Nancy to death. So we have some interactive exercises to help her practice her important relaxation techniques. She can invite a friend to join her anywhere, anytime in a coping session. So, because it's weekly and scheduled, it builds accountability and a social support network. Nancy's also been having a hard time finding people who've actually shared this horrific experience, and because of that, we have social support systems. In this particular case, it's called Fear of Driving, and all the users can edit their privacy settings as they would like. And last, and unlike all the other applications, the data that Nancy enters is hers to keep. It's used to create an anxiety map, identifying patterns in her anxiety and helping her understand the causes behind it. Currently, there are 30 million people suffering from anxiety, but for the purpose of our application, we're going to focus on this segment here: high school and college students as well as young professionals, since they've demonstrated high cell phone usage. This doesn't even address the post-clinical segment that we could help with our solution. Now, what we need before we bring this to patient is data-driven insights. We've scored an incredible opportunity with the U of M Depression Center. We actually have a clinical trial in September where 200 anxiety patients will be using our application, and we'll use those insights that we gain from that to improve our solution for patients. So if we do win this competition, the money that we gain will be used to compensate patients and secure a back-end programmer for this phase. Also, we really need a way to be sustainable. We've decided on a monthly subscription model by comparing ourselves to our competitors. So currently, we're at $10 a month with a special for college students. To give you an idea of where we are, we have a timeline here. So we're currently in the paper prototyping phase. We're starting to see patterns. So in May, we'll be able to move to prototype coding. In September, our exciting clinical trial starts. And then by 2016, we should be able to take that data and hit the markets. So why is all of this important to people like Nancy? Why does this matter? Well, we can address the initial problem of the high dropout rate in therapy, but it goes so much further than that. We can also increase engagement in therapy, which is proven to improve outcomes. We can help patients who are no longer in therapy continue to track their progress and stay a part of a social system to improve. We can also reduce family and friend burden. And last, and very importantly, we can reduce waste of ER and financial resources. And what's a better team to do all of this than Team Change of Mind? We're so excited and driven for what we can accomplish. We come from backgrounds ranging from operational management, public relations, data analysis, writing, and design. Right now, I'm going to introduce you to Sean Ma, our postdoctoral researcher in psychiatry, to help field your questions. Thank you so much for listening.
Thank you, Lamise. I'm Sean Ma, co-founder and also postdoc in psychiatry. First, I want to really commend my team members of their efforts in going through this journey with me. Reaching out to patients and clinicians is not an easy task. We sat in numerous group therapy sessions at night, drank far too much coffee with patients. We listened and empathized with patients, 100 of them, one at a time. Thank you, team. I'd like to field your questions now.
So you guys know who can ask, so go ahead.
I'm going to go first on this one. So, a great presentation, and I appreciate how much time and effort you and your team have put into this, but I'm feeling a little bit anxious.
Let me give you our app.
Okay, so when I'm feeling anxious, what I do is I take this phone and I hit this like this, and it says slide to off. I slide it off. And I have my iPad that I'm always with, according to my better half and loved ones. I'm going to set it aside. And even though I'm in the 4th best school of public health in the country, I'm going to then take my 25-year-old scotch. I'm going to pour it, and then my cigar, and relax. What would you say to someone like me who's feeling a little bit anxious?
Judge Greg, I would say you're a fortunate man and very lucky man. There are a lot of patients seeking psychotherapy and really suffer this from day-to-day life. They might not have the luxury of turning their cell phone app off or bring a scotch at night with them, but they're really being tasked by their clinician of what happened to you last week within the days that I haven't seen you. How can you show me your what's been going on with you? A lot of these, they have to recollect with memory, and human memory fails often the time. So we're not trying to make them more anxious. We're trying to make them be better, be more engaged with their treatment with clinicians. We're not taking the clinicians out of the picture. We're helping clinicians and supplementing their work to have a better engaged patient.
Good presentation. I believe the social network component is really important to be able to look and find other people. How are you going to get that initial network established? How do you get enough people using it so there's others like you in the network?
Yes, thank you for that question. We talked to patients, and we heard that initially they would want their friends and family to start off with. So we are featuring some privacy settings that they can send specific invites to their friends and family or share specific data to them so that their progress or what's going on in their mind can be directly gone into their family or care members' same app and really get to know them. And we start off from building this strong support network, and then through more and more adoption to this, we will increase like the other social exercises that they can ask their friends to join them at the specific time, regardless where they are, and building up accountability just like we go to the gym with our buddies.
The subscription model, patient pay, insurance company pay, who's going to actually be your customer and who's going to pay?
Right now, patients paying for $10 per month. We came to this model based on two aspects. One is listening to patients. How much are they willing to pay for this type of service that can help them and be more engaged? Second, we also landscape the competitor models. And from what we learned, like Lantern, they charge $50 per month for their patients to just use them. And we're at this $10 per month, we think we can undercut their services and provide a better experience. Okay. Thank you.